Hi, my name is Kevin Leonard. I'm a faculty member at the University of Toronto in the Department of Health Policy, Management and Evaluation in the Faculty of Medicine. I'm also a research scientist at the Center for Global eHealth Innovation, and I founded an organization called Patient Destiny. Patient Destiny fights for the rights of patients to get access to their own health information that lies within the healthcare system. I am a patient and have had Crohn's disease for over 40 years, and it's a combination of being a patient, a teacher, and a researcher that provides a unique perspective on building eHealth systems. I wrote this paper because I felt there was a void in the academic literature around building eHealth tools. We have seen and heard a lot about promise that eHealth tools could deliver great benefits to the healthcare system. This promise has been around for about 25 years, yet we really have not realized the gains that we've been expecting. We've seen success, but we've seen more failure than we would want to have seen. And we know that there's a lot of evidence out there that can help support and increase the likelihood of successful implementations. So the challenge really is, can you build a theoretical model that'll identify the successful criteria that should be followed, and that would help as best as possible to increase the likelihood of a successful implementation of an eHealth tool. So I put together a research paper that comprised of a number of different either components, perspectives, or models that altogether hopefully will help support the developers and designers of eHealth systems. So the TEACH model is the first model that's in the paper, and the TEACH model stands for the Technology Adoption Criteria in Health, and basically emphasizes that a transition from paper to electronic requires work and also requires measurement. Work in the sense that there needs to be a duplication of effort in the short term so that we can get from the old system to the new system. To know that the work is getting better and more sophisticated and the outcomes are starting to be realized requires measurement. So we need to identify the right indicators, but that'll help us give us a progress report, if you will, around how well the adoption is going. The second model is the patient-centered care model, where we emphasize that the patient is the center of care. The patient is the one that begins the journey, and they interact with the healthcare system and present themselves with a medical condition or problem. There, a eHealth tool can be very beneficial in standardizing the intake of information for the physician and for also helping the physician determine what is relevant and what isn't relevant, and to be able to translate that information back, that diagnosis back, treatment options back to the patient. So patient-centered care really states it begins and ends with the patient. So if we look at both of these things together, we have a patient and we have the TEACH model where there's an increase in work in treating the patient. The question is, well, where does the benefit come in? Well, the benefit happens down the road. The benefit happens not in the first year, but in multiple years down the road. And that's because there has to be a transition from interactions with the healthcare system on behalf of the patient from something that's just regular ongoing to more maintenance at the beginning and avoiding long-term costly interventions later on. Costly interventions like going to the ER, OR, or ICU. So we need to focus in on the right patients and as early adopters, and those are patients with chronic conditions, or what we call 3Cs, consumers with chronic conditions. And these patients have a big investment. All of their health is invested in our healthcare system. So they want to be able to rely on the system, have the system there when they need it, and be able to monitor their condition. Because the earlier they jump on their condition and change, the better they will be in the long run. That then leads to reduced costs and improved health outcomes.